Hello my dear viewers, welcome to Vinay Voice. So today we are going to discuss about an important LAQ from the head and neck. See, this is our mouth or it can also called as oral cavity. So in this oral cavity, we can able to observe an important structure which is also known as the universal toothbrush, that is the tongue. So this tongue is a mobile organ, that means it can be moved, and it is a muscular organ, that means it is made up of muscles. So what type of muscles are there in the tongue? Those are the skeleton muscles, because the tongue movements are in our control. So the tongue is made up of skeleton muscles, and the tongue is covered by a layer of mucous membrane. Okay, so the tongue is a mobile muscular organ in the oral cavity. The mass of skeleton muscle covered by a mucous membrane. So this is the introduction of the tongue which you have to write in your exam. Next. So what are the functions of the tongue? First of all, the taste. Yes, with the help of the tongue, you can able to perceive the taste of sour, sweet, spicy, bitter, etc. And speech. Yes, while we are speaking, the speech is possible only with the help of movement of our tongue. Next, mastication is nothing but chewing of food. With the tongue only, we can chew the food and we can mix the food with the saliva. And next, deglutition is nothing but swallowing. So with the help of the tongue only, we can able to swallow the food materials. So these are the four major functions of the tongue. Yes. Next. So if you see, my dear friends, the structure of the tongue is conical in shape, right? The tongue is conical in shape, and it is being elongated in the posteriorly and anteriorly. See, this is the posterior border and this is the anterior border. So it is elongated posterior anteriorly, right? And next, this is the dorsal surface. The below one is the ventral surface. So dorsally ventrally the tongue is flattened. Okay, I repeat, the tongue is conical in shape and it is a posterior border, it is the anterior border, it is elongated anterior posteriorly, and this is the dorsal one, the below is the ventral one, it is flattened dorso-ventrally. So here the tongue is conical in shape, being elongated posterior anteriorly and flattened dorso-ventrally. So this is the shape of tongue, right? So next, so what are the external features of the tongue? Those are root. So this is the root here, and second one is the tip. This is the tip, and next, body. The portion between the root and between the tip is the body. So this is the entire surface of the body of tongue. So the important point is to remember here that from the root, whatever the blood vessels and the nerves of the tongue will be entered from the root. So the root is the main portion from where the nerves and blood vessels will enter. And the tip is anterior free margin, right? The tip is anterior free margin, and the body of the tongue. The body of the tongue is made up of muscles, right? And this body of the tongue exhibit four features. Those are the dorsal surface, this is the dorsal surface, and the below one is the ventral surface, and the two margins, right margin and the left margin. So the body will exhibit four boundaries. Those are dorsal surface, ventral surface, right and left margins. So this is the information you should write in the external features of the tongue. Okay, so let's recall once again. The root, the nerves and vessels of the tongue enter through its root. The tip, anterior free end of the tongue. The body, it has dorsal and ventral surfaces and right and left margins. Okay, so next we will see the dorsal surface of the tongue. So this is the dorsal surface of the tongue which you can observe in this picture. So it is divided by a V-shaped sulcus, the sulcus terminalis, into two parts. You can observe here, this is the V-shaped sulcus, right? This is the V-shaped sulcus. So this V-shaped sulcus divide this whole portion of the dorsum into two parts. That is, this is the first part, this is the second part. So this is the anterior part, this is the posterior part. The anterior two-third part is also known as the oral part, and the posterior one-third part is also known as the pharyngeal part. I repeat, the anterior two-third part or the oral part, and the posterior one-third part, that is the pharyngeal part. So this is the oral part and this is the pharyngeal part. Okay, next. So now we will look at the foramen cecum. So what is meant by foramen cecum? Let's see it. So the apex of the sulcus terminalis is marked by a blind foramen is known as foramen cecum. See here, this is the sulcus terminalis. This is the apex portion of the sulcus terminalis. So at the apex portion of sulcus terminalis, we can able to observe a blind foramen, a blind foramen. So this foramen is known as a foramen cecum. So which indicates the point of origin of median thyroid diverticulum, or you can also call it as thyroidoglossal duct in the embryonic life. So this foramen cecum is indicating the origin of thyroglossal duct in the embryonic life. Okay, next, oral part. So let's see about the oral part. So you can see this is the oral part. This is sulcus terminalis. This sulcus terminalis divided this whole dorsum of the tongue into two parts. That is the oral part, which is anterior two-third, and this is the pharyngeal part, which is the posterior one-third. So a median furrow representing the bilateral origin of the tongue and a large number of papillae. See here, there is a median furrow on the oral part of the tongue. That is known as the median furrow, that because it is presented exactly in the middle of the dorsum of the tongue. So this furrow divides the tongue into two halves. That means we can able to say that the tongue is a bilateral in origin. Bilateral in origin. Along with that, we have some papillae. What are the papillae? Those are valid papillae, foliate papillae, filiform papillae, and the fungiform papillae. So this valid papillae is present adjacent to the sulcus terminalis. See here, this is sulcum terminalis. So this valid papillae, those are present adjacent to the sulcus terminalis. And next, foliate papillae. Folium means leaf-like structures. So these are the papillae which are in leaf-like structures. And the filiform papillae. These papillae are abundant on the dorsum of the tongue. So these papillae are the abundant on the dorsum of the tongue. And next we will see the last type of papillae, that is fungiform papillae. So this fungiform papillae will present at the margins of the tongue. So the important point which is remember is that this foliate papillae is more prominent in the rabbits because they more eat the plants like plant leaves, right? So they are more prominent on the rabbit, but they are rudimentary in the humans. So these foliate papillae are rudimentary in the humans. So next, please observe the structures. So this is the diagram indicating the filiform papillae, this is the fungiform papillae, and this is the circumvalid papillae. See here, the circumvalid papillae have the sulcus. Along with that, they also have the taste buds. These taste buds will helps to perceive the taste of food materials. And next, this is the fungiform papillae. You can also see that this fungiform papillae also contain the taste buds, but this is the filiform papillae. This filiform papillae does not contain any sort of taste buds. So this is an important point you should mention in your examination, that the filiform papillae does not contain any sort of taste buds. So this is about the papillae of the tongue. Next, we will look at the pharyngeal part of the tongue. So which is the pharyngeal part? This is the pharyngeal part of the tongue. So a large number of lymphatic follicles which together constitute the lingual tonsil. So you can see that the whole pharyngeal part of the tongue is covered by lymphoid follicle, right? So these lymphoid follicles constitute the lingual tonsils. this lymphoid follicle together constitute the lingual tonsil, and it also contains the mucous glands and the serous glands. Mucous glands is nothing but which secrete the mucus, and the serous glands is nothing but which secretes the watery secretions. Okay, right. Next. So ventral surface of papillae, or it can also called as inferior surface of papillae. So this ventral surface of papillae will exhibit the frenulum linguae, deep lingual veins, and the plica fimbriata. So let's see the structures. What are these? Okay. So the ventral or the inferior surface of the papillae, the ventral or inferior surface of the tongue will contain frenum linguae. See here the structure, the black colored one, the black colored margin, this is the frenulum linguae. So the frenum linguae, a median fold of the mucous membrane connecting the tongue to the floor of the mouth. So if you assume that this is the floor of tongue and this is the tongue, so this frenum linguae will collect the tongue with the floor of the mouth. It is a mucous membrane fold, right? It is a mucous membrane fold which will connect the tongue with the floor of the oral cavity. Okay. Next. Ventral or inferior surface of the tongue. So, next one. Deep lingual veins may be seen through mucous membrane on either side of the frenulum linguae. See, this is the frenum linguae, and these two are the deep lingual veins. So, these two deep lingual veins are located on either side of the frenum linguae. So, they are located on either side of the frenum linguae. Okay, next. Plica fimbriata, a fringed fimbriated fold of mucous membrane lateral to the lingual vein. So, if you see that these are the lingual veins, right? So, lateral to these lingual veins, there is a fringed fimbriated fold of mucous membrane which is known as the plica fimbriata. Okay, which is present lateral to the lingual veins. Okay, that's all for today, my dear friends. Thank you for watching. So please drop a like and share this video to your friends, and don't forget to subscribe my channel, hit the bell icon, drop a like, don't forget to share. Have a great day, my dear friends. Take care. Bye bye.